Good afternoon, Chairman Hansen and members of the Health and Human Services Committee. I'm Megan Hunt, MEGANHUNT, and I'm here to present LB488, the Sexual Assault Emergency Care Act. This bill would require hospital emergency rooms to provide medically accurate information about emergency contraception to patients who are victims of sexual assault and dispense a complete course of the medication if the patient requests it. Emergency contraception refers to a concentrated dose of hormone found in many regular birth control pills that can prevent pregnancy when taken shortly after unprotected intercourse. It's a backup birth control method used to prevent unintended pregnancy after unprotected sex or sexual assault. Emergency contraception works by delaying or inhibiting ovulation, and it will not work if the woman is already pregnant. The medication is effective if taken within 120 hours after unprotected intercourse or assault. Some people confuse emergency contraception, which you may hear called Plan B, with medication abortion, which is sometimes called the abortion pill. These are two completely different things. Medication-induced abortion is used to terminate an existing pregnancy, whereas emergency contraception prevents fertilization from ever occurring, meaning emergency contraception is not in any way abortifacient because fertilization has not yet occurred and there's no existing pregnancy. So it's a completely different mechanism and purpose for these drugs, and emergency contraception is not in any way related to abortion, and it cannot cause an abortion. When a rape victim has endured what is likely one of the most traumatic events of their life, taking that step to go to an emergency room can be extremely emotionally fraught in a time that they are already in shock. A survivor will have to disclose what happened to them probably several times, reliving that trauma. And sometimes the rapist is somebody they know, as is most often the case. Maybe they have complicated feelings about coming forward or naming their attacker. Perhaps they're afraid of letting their family know what has happened to them. So when a sexual assault survivor has the courage to go to an emergency room, the last thing they should have to worry about is this hospital going to provide me with medically accurate information that I need? And yet a sizable share of Nebraska hospitals do not offer information about or dispense emergency contraception to sexual assault survivors. Organizations that advocate for survivors have heard many stories, and I have too personally. I've heard lots of stories of Nebraska hospitals who have either not provided this information or have not provided the treatment. But it's difficult to get hard data on this because hospitals don't publish any policy on the record. I've heard from several sexual assault survivors specifically that CHI Health is not providing this care, and that's a major healthcare provider in Nebraska. And because the law is currently silent on this matter, any hospital is free to choose not to provide this information or medication. And that's why we need this bill to be enacted into law. I can't, Emergency contraception is safe. It's established and widely accepted in the medical profession. 21 states require emergency rooms to provide emergency contraception-related services to sexual assault victims. Nothing in law obviously can force a person to take the medication, but it should be part of the information that survivors receive when they go to the hospital. The American Medical Association and the American College of Obstetricians have both issued recommendations that physicians provide sexual assault survivors with emergency contraception upon request. LB488 would provide uniformity and a guarantee to Nebraskans who might one day visit an emergency room that all hospitals follow the standard of care when it comes to emergency contraception. The last time a traumatized rape survivor should have to be responsible for is tracking down a hospital policy or a person on the phone at a hospital who can tell them whether or not the hospital will provide them emergency contraception. And imagine that they do know about this. Imagine that someone survives an attack and they do know about the existence of this law. And they're in the ambulance after surviving a horrible attack and they're just saying, please don't take me to CHI. That's what I would be saying. I'd say I can't be in up there for a crime like this. I think we should also consider that as Nebraska is poised to pass an abortion ban, we should be doing everything possible to prevent the need for abortion, especially for rape victims and people who experience assault, especially because it's unclear under the abortion ban that's before the legislature in practice how rape survivors will be able to access abortion in Nebraska. Thank you. I will turn it over to testifiers, and I might be able to share some more information at close, but I'm happy to answer any questions.
Thank you for your opening. Are there any questions from the committee? Yes, Senator Kavanaugh.
Thank you. Thank you, Senator Hunt, for bringing this bill again. My question is actually more for CHI, but I don't know if they're testifying. Are you aware if they're testifying today?
I don't
Okay.
know.
I'm going to put it to you since you brought them up. So do they offer emergency contraception at all? It's not available?
I don't think so.
Okay.
I don't know. I know that we've heard stories that patients have not been able to get it there.
Okay.
I don't know if that means they don't have it or they won't give it, or how often they refuse to give it, because we don't have any data about that. And there is no published policy about it either.
They don't have a published policy
Right.
about it. Okay, interesting. Well, I hope that they're somewhere in the room and going to come testify so I can ask them some questions. But thank you.
You know, every time I introduce this bill, that is the question. And it's interesting that we don't know. I mean, don't we want to know if hospitals are at least giving this information to patients? Because what we hear from patients is that they're not. So
Right,
at least we should figure that out.
right. Thank you.
Any other questions from the committee?
Oh, actually,
Senator Kavanaugh again.
I'm sorry. Sorry. The department has a neutral letter. I don't know if you had a chance to look at it.
Yes, I have.
But in it, it's,
I don't know if I have a copy of it here, but yeah.
I'll just review
Uh-huh.
the sentence about the report requires a report to be submitted to the clerk on December 1, even number years. The bill requires that complaints related to sexual assault are confidential, yet the requested report is required to include the nature of the complaint and the hospital in which the complaint is made. Providing this information would no longer make the complaint confidential or non-identifiable. And again, not for you to answer, but since they submitted a letter, I'm assuming they're not coming. So give you an opportunity to speak to this. I feel like there's other reports that hospitals have to make that are, I mean, not
Right.
related to sexual assault, but
I mean, we haven't talked about, you know, for the record, you and I haven't spoken about this. I don't know what you're
no,
going to
we
ask me,
haven't
but,
actually at all.
um,
Sorry.
No, I read that letter over my lunch break, and I don't really agree with that assessment. I mean, it's not saying, you know, put the social security number of the patient and say what happened to them.
Right.
It's possible to give a report to the legislature on the use of emergency contraception without violating anybody's privacy.
Assumedly, if CHI, for example, treats, I don't even know how many thousands, tens of thousands of patients a year, if people are filing complaints against CHI, having us know that CHI as a hospital is having complaints filed by victims of sexual assault would not tell us who those victims are.
Right,
Okay.
right.
Yeah.
There's all kinds of reports we get where you can't identify the person outlined in the report, whether that's a complaint or a report about, you know, opioid treatment or like all kinds of things that we have
Okay.
reports on.
Thank you.
Any other questions from the committee? I think Senator Kavanaugh took my question. That's what I was going to ask. I was concerned about the report because I think there has to be some identifiable information on there, because then I think the hospital then has the ability to appeal the decision the department might make, which can then have a hearing. So then I think, but I don't know for sure how that works. You're right. I think we do reports like the opioid stuff for like a PDMP, but we have information on that, but that doesn't have identifiable. They can't divulge identifiable information. So I'm curious how the report will work. That's
I agree with you. I think my intention with the bill is clear. And, you know, if there's an amendment that makes it more palatable for the committee or it makes it work better for the department, that's what I want. I mean, I don't care how we get there. I think my intention's clear with the purpose of the bill for sure.
cool. All right. Thank you.
Thank you.
Seeing no other questions, you're sticking on the close? Cool.
Thanks.
All right. We will welcome Senator Hunt back up to close. And for the record, we had 18 letters in support, 3 letters in opposition, and 1 letter in the neutral capacity for LB488. Welcome back.
Thank you, Chairman Hansen, and hello again, colleagues. In closing, one thing I want to mention is that the sexual assault payment program, which is in Nebraska, And they have reports and tracking on the Attorney General's website. And the most recent report from the 2019-2020 fiscal year showed that 43% of the medical forensic exams that provided to assault victims were provided to children aged 12 and under. So, you know, the Attorney General of Nebraska is reporting 43% of the sexual assault victims they're looking at are 12 and under. So emergency contraception here is really vital to protect these children from unwanted pregnancy. And, you know, is a 6-year-old getting pregnant? It's happened in history, but probably not, you know, super likely to happen. Is a 12-year-old getting pregnant? Yeah, that's super possible. And these reports provide overviews of those sexual assaults that are reported to medical providers, and they provide reimbursement for the sexual assault exams that they do. So this isn't the entire universe of sexual assaults in Nebraska, because we know that so many aren't reported, but it does reflect how many young people this type of thing really affects. Look, you know, you can have your feelings about when life begins, but the fact is emergency contraception does not terminate an existing pregnancy. It just doesn't. It just doesn't. Like, people feel certain ways about contraception, condoms, anything going on inside, around, or about a uterus is really interesting to a lot of people, but the medical facts are that emergency contraception prevents ovulation. It doesn't prevent an existing pregnancy from continuing. And a standard part of any intake for a sexual assault survivor is also a pregnancy test. So if the person was pregnant, you know, they wouldn't be able to get this anyway. You know, once again, I think we're going to be legislating perhaps from a philosophical religious place instead of a science-based place in a way that is actually going to be really harmful to Nebraska women, especially if we move forward in this state banning abortion. And with the statistics that we see from the Attorney General's office, we know how many of these people affected could be children as well. So with that, I'll close, and I'd be happy to answer any other questions. Oh, I got one more thing, actually. This, I got a copy of the handout from Tom Benzer at the Catholic Conference, and my ears perked up when he was reading the directive from the Catholic Church that says, a female who has been raped should be able to defend herself against a potential conception from the sexual assault. I don't know what that even means. I don't know if this is some Thomas Hilger's, you know, legitimate rape type of argument, like if it was a legitimate rape that she wouldn't be pregnant, which is an argument that he has made and that many politicians have repeated, but that has no basis in fact. So, I mean, even just reading that on the handout makes me kind of discount the logic of this type of argument. But if there's a medication that a rape survivor can take who is not pregnant that we know will prevent her from becoming pregnant with her rapist's baby, we should let her take that. And that's what the science shows, and that's what the medical consensus is that hospitals should do. Oh, and one other thing, one more time. Nothing in this bill says that an individual provider is forced to give this medication to somebody. So if somebody has a medical or a religious objection or something like that, if there's a doctor who says, I'm not going to be giving out emergency contraception because I believe the stuff in this pamphlet, they don't have to. They can have somebody else give it. The law just, or the bill just says that the hospital has to provide it. So a nurse could give it or anybody else in the hospital. And it also wouldn't affect any clinics, just hospitals. And I am finished. Thank you so much.
Okay. All right, thank you. Are there any questions from the committee? Yes, Senator Reapy.
Thank you, Chairman Anson. Because I do like facts, you said that 43% of the assaults were 12 years old and under. Mm-hmm. Along with percentages, I always like absolute numbers. How many? Do you have a number on that?
Yes, the number is. So this is from the Attorney General's news release from January 27, 2021, and it says, over the course of the sexual assault payment program, 4,086 medical exam payments, and 43% of them were to children under 12. So
you said 4,000?
4,086. So
over
40,
what time period, please?
43% of that. The last 3 years.
Last 2 years?
Yes.
Okay, thank you. Thank you, Mr. Chairman.
Yep. Any other questions from the committee? I had one. You mentioned, unless I missed it, is there in the bill the requirement that they, before they provide the emergency contraception, that they have to do the pregnancy test or check for luteinizing hormone?
It wouldn't be in the bill because that's already the standard of care.
Okay.
It'd be like putting in the law that you have to take someone's blood pressure. Like, they already do it.
Okay. I was just kind of curious about the part. Senator Kavanaugh.
Thank you. In answer to Senator Reepe's question, those numbers are based on those that have had a rape kit conducted.
That's right. And so we know that this does not represent, probably a portion of the actual assaults that happen in the state.
Thank you.
Just make sure. Any other questions for the committee? All right, seeing none.
Thank you.